Q&A session where I will be answering questions on the pelvic floor and pelvic floor dysfunction. So let me just check to see that this is definitely online. Let's see. No. Okay, looks like everything is now live. So if you have some questions, please feel free to submit them in the comments and I will answer. For those of you that have been doing the 30-day challenge, I see Henry, you have said that you're in the loop. Fantastic that you're getting the 30-day challenge in. For those that have been doing it, it is not really something that you would normally do over 30 days. It takes you through different phases of training that you typically would do over a much longer period of time. So let's say you're working on the exercises in the first week and you find that they're a little difficult, then I would advise that you actually do those exercises over a number of weeks until they start to feel a little easier before progressing on to the exercises in the second week. But if you have signed up for the challenge, you will have seen in the email and the bonus videos that you get, you would have seen that explained. So hopefully if you're doing the challenge, then you're following along with that. So I have all of the different possible pelvic floor devices that you can use here. If you have a question on a device or if you have a question on a specific condition related to pelvic floor dysfunction, then you can go ahead and ask that. So let's just see. We can start maybe. I wonder if anybody actually made it to the fourth week of the challenge, which was where we focused on some really dynamic movements. This would be the advanced stage of pelvic floor training, and it's quite dynamic, so it's a lot of jumping and lifting and pushing and pulling. So I wonder if anybody managed to make it that far. Sonia is saying thank you for me as well for the challenge. I learned a lot and would love to see more yoga routines. We actually have a yoga routine coming on Thursday, so tomorrow, that will use the maximum strength contractions, and I have a couple of other yoga routines planned also for the upcoming Thursdays, along with some other strength exercises, because very important of course to work on all body strength rather than just the pelvic floor. And sorry, you made it until the last week. That's fantastic. It really, it's one of those things. I was a little unsure when I was putting the video out, but like especially the later stage videos, if it would be too much, because typically if you're only starting to rehabilitate the pelvic floor, then the later days of the training in the challenge will be really tough. But I mean, of course you can try them, but very, very, very important to listen to the body. But fantastic if you made it there. And then of course the stronger yoga and other exercises combined with the pelvic floor exercises will really bring things along. Particularly, I mean, if you're suffering from pelvic organ prolapse or incontinence or any of those kinds of conditions, then it really makes sense to train the body to be able to work in all of the different directions under different levels of load. So let's see. Danielle, welcome. You say you're sorry, you will carry on doing the exercises until you finish the 30 days. Do. It's I think they're good to do, and I every video made sure to put in a little relaxation at the end. It's very important when working on pelvic floor strength that you also work on relaxation, but also important that if you have a condition of hypertonicity, that you focus on relaxation and that you get your pelvic floor to the stage where there's no pain and there's no longer tension, and then you can feel to see if there is strength, and if you're missing some strength, or if you find that after dealing with hypertonicity, if you're unable to produce good strong contractions, then you can start to add a little bit of strength work. But always listen to the body, progress very slowly, making sure that you pay attention to what your body's telling you, because it is always whispering in its subtle language, and if you can hear what your body is saying, then you can prevent yourself from creating injury or moving further into dysfunction. So that's very important. So the question is, does anyone have any questions today? Is there anything specific that you would like me to talk about? I'm very happy to talk about anything pelvic floor dysfunction. Meredith says, I was not ready for the 30-day challenge yet because I'm at the beginning of recovery, but I'll be getting started soon. That's really good. Very fantastic to hear you're not starting until your body's ready, because that is really what I believe. You have to listen to your body. Laura asks, do you know what it means when my pubic bone is burning after defecation with urination? Is it also due to a tight pelvic floor? It can be. It can also be related to your adductors, and it could also be related to your to some of your abdominal muscles. So there are a couple of different things that could be playing into pain and burning around the pubic bone. Do you know, I mean, how is your flexibility? Do you have good hip extension and flexion? And are you able to like open the legs wide? Are the hips nice and flexible? You know, can you do nice hip rotations? Can you squat? Can you get into like a good range of motion with the hips? It would be worth checking your range of motion to see if there's any range of motion lost, because very often when there is pain, there's also a limit in range of motion, and it can be very nice to do some yin style yoga where you relax a little bit into poses that gently work on stretching the connective tissues. So I don't know if you saw the relaxation video that was posted yesterday evening, but that one, if you kind of scrub through it quickly, I did put a little story yesterday showing over the course of 5 minutes how much the legs opened in the legs and the wall straddle. So there's quite a big let go when you can kind of relax into the body. Okay, so you've got good flexibility, but you're having discomfort because of an urge to pee constantly. Okay. So when you have urgency, one of the first things that you need to do is to try to let go of tension. Yoga Nidra, very good way to scan the body looking for tension and to let go, and that can also help to relax and de-stress a little. The next thing that you need to do is to try to tap into the guarding reflex to relax the bladder. So by contracting, when you feel the urgency, you have that sensation of urgency. If you can contract the front part of your pelvic floor, so that little front urogenital diaphragm, if you contract there, you're trying to reach the external urethral sphincter. And when you contract that muscle, you tap into a reflex arc that relaxes the bladder. So this is sending a signal to the nervous system to say, I'm not ready to urinate yet. Now, with urgency and overactive active bladder, these types of conditions, generally what's happening is the bladder is spasming a little, so it's creating contractions before it's actually time to empty. And this can happen for a number of reasons. So if you just in case pee, so if you always go to the bathroom before your body tells you the bladder is full and it's time to pee, that can create a situation where your bladder doesn't ever get to really fill and then starts to think that it's full when there's very little urine in the bladder, and it'll start to give all these I need to go signals, even though there's plenty of room left for the bladder to expand. So a little bit of bladder retraining if you haven't already tried it, and that little tip of when you feel the urgency, stop whatever you're doing. Really good if you can sit down, relax your body, and then contract that front part of your pelvic floor. You can contract it, hold it for a wee moment, relax, contract, relax. You can do that a few times, or you can take a contraction and hold that for 20 or 30 seconds and see if that allows the bladder to relax. So that should be, hopefully that should be helpful in toning down the spasm of the bladder, so that sensation of urgency. And then also if you do the pelvic floor relaxation videos, that can help to take a little more tension away, which can really contribute to less urgency. So we have another, I hope that answered your question, Laura. We have another question here. Sorry, Laura, you just have a follow-on question. That isn't the same as Kegels. It is. So imagine doing a Kegel on the front part of your pelvic floor. That's what you're doing, but you want to relax your body when you're doing it, and you want to stop when you get the urgency. So wherever you are, whatever you're doing, stop and get that pelvic floor to relax, and just contract the front part to get the signal through to the bladder to tell the bladder to relax. So you're tapping into a reflex, the guarding reflex for urination. So hopefully that makes sense. Okay, so Gail has a question. Hi Denise, I would like to know if pelvic tightness causes pain around the tailbone and the low back. Also, can pelvic tightness cause constipation? So the answer is yes to both of those questions. Pelvic tension can contribute to low back pain, and vice versa. Low back pain can also contribute to pelvic tension. Very often if you have low back pain, you may be a little weak in the abdominals. So the abdominals actually provide support for the lower back, and if the abdominals are weak, there would be a tendency to have a little bit more flexion in the low spine, which gives a little bit of extra compression on those joints, so in between the different vertebrae, and that can create some lower back pain. And also if the abdominals are weak, then the pelvic floor would need to take a little bit more load, because those muscles usually work in synergy. So the answer is yes. And when it comes to constipation, so a tight pelvic floor can prevent the relaxation that allows proper defecation. So it can be more difficult to actually evacuate stool if your pelvic floor is tight. So you should really work on pelvic floor relaxation exercises. Now the relaxation video that I posted last night has the caterpillar pose, which is a forward fold, and what that does as well for the low back is that it lengthens the low back. So actually you allow the weight of the head and the weight of the chest to surrender forward, and that creates a little bit of length. So what it does, imagine the spinal column. It takes the spinal column and it gently pulls the vertebra away from each other, creating a little bit of space, and you have your discs in between all of those vertebrae, and there's synovial fluid in those discs. The synovial fluid is like a superfiltrative blood. So when you allow this kind of pulling of the bones away from each other, you allow a little bit of rejuvenation of the discs, and this can be really good if you're suffering from low back pain. But you do have to be very mindful when you practice that you don't allow yourself to move into pain. You practice that style of yoga, the yin style of yoga, by paying attention to your edge. So when you feel that you're moving out of just relaxing into your own discomfort and into a place of pain, then you come back a little. You stay at the edge, and you can use a bolster or something else to support you. The other thing with constipation, very important that you elevate your knees. So you can put your feet on a little stool. I do have a video on how to poo, so you could watch that, get a little bit of information there. And make sure also that you have sufficient fibre in your diet so that the poo is smooth. It should be a 3 or a 4 on the Bristol stool scale. If you go onto the flowerimpowered.com, we do have a Bristol stool scale on there, so you can have a little look and see what it should look like. It should be a nice smooth sausage, so not little hard balls, and not runny, because either of those can also cause issues. So I hope that answers your questions, Gail. And let's see. Neha says, I'm facing vaginismus. I'm very sorry to hear that. I hope you've maybe looked at some of the videos on the channel. We do have a few for vaginismus to talk about that. You're asking what exercise should I do daily, and you have anxiety. I would start with Yoga Nidra. That's a body scanning meditation where you relax, and it's one that kind of helps to calm the nervous system, which is really important if you're dealing with any pain condition or if you're dealing with vaginismus. Now then there are some relaxation exercises that you can do that can help with particularly with the adductors on the inside of the legs. So the adductor muscles on the inside of the legs are like, they can emit a protective response that you can sometimes get with vaginismus, where the legs want to slap shut. So if you can get those muscles to relax, and if you can allow an opening, if you can allow yourself to relax with the legs open, that can be a good step towards being ready for dilation. And then we have a video showing just some tips for dilation. So one thing to do is to support the legs so that you can actually relax them, because very often the adductors will be tight if you're suffering from vaginismus, and the legs won't want to relax. So you need something to hold the legs so you can actually let go of the grip. Those muscles are connected fascially to the pelvic floor, and you want the pelvic floor to relax. So by relaxing those muscles, you allow the pelvic floor to relax. There's also reverse kegels that you can do, where you inhale, and on the inhalation you relax the pelvic floor and you allow an expansion. So you're not actually bearing down, but you're just allowing everything to relax. You can do that along with a ball sitting exercise, and we do have a few pelvic floor relaxation videos on the channel that show how to use the ball, and that can be very effective in getting things to relax before you try to work with dilation. So I hope that helps. Let's see who else we got. Ruth is sending a virtual hug from Boulder, Colorado. Very nice. Welcome, Ruth. I love Boulder. It's just over a year and a half since I was last there. It's a beautiful, beautiful place. Sandy says, hi, I wrote to you about fissures. Okay, anything I can do to relax the painful spasms? Yes, so fissures are, this is where you get a little bit, the tissues can be a little bit light, so the epithelium and the tissues on the inside of the bowel can be quite light, and sometimes those tissues can tear a little. Now this can be due to dryness, it can also be due to hormonal changes, or if you have hemorrhoids or piles, that can also sometimes cause a little bit of tearing. Constipation can also do the same thing. And when you have fissures, you really need to try to get the pelvic floor muscles to relax. You need to try to, as much as possible, let go of not just pelvic tension, but tension in the body. It will take a little bit of time. It's very important that you use whatever treatments your doctor gives you. So he may give you some sort of a cream or a suppository that you can use to help to take away the pain around the tissues. So the tissues, there is a little bit of tissue damage when that's there. And then I would advise restorative styles of yoga or relaxation where, so for example, the relaxation video that I posted yesterday where the legs are up the wall, for example, and you're allowing a wide straddle, use the strap around the legs instead of allowing the legs to open all the way out. So you can do the relaxation videos, but take extra support rather than letting go into the position completely, because you don't want to have such a big movement, but you still want to be able to let go of the muscular tension. So I hope that helps. Please do feel free to ask another question on that if you want, Sandy. Melissa says, can prolapse, stage 2 bladder, uterus and rectum cause infertility, or is my stress associated with these more likely to be contributing to infertility? It's a really difficult question. I have not seen in any of the literature a direct link between infertility and prolapse. Now, stress definitely contributes in a very big way to infertility. I know of more than one couple that struggled, that went through a lot of IVF, and they basically, when they gave up, they got pregnant. And this very often happens because when you give up and you stop trying, everything relaxes. But of course, it doesn't always work like that. It's very important, if you haven't already done so, to go and speak with your gynecologist and to work with your gynecologist, and as much as possible to reduce stress from your life. Now, when it comes to your prolapses, it can be very difficult to not feel very stressed when you know you have a prolapse. But I want you to remember that a prolapse is, it's not the end of the world, and it's not inevitably going to get worse. So a prolapse is a potential for expansion when there's additional intra-abdominal pressure. So if you learn to control your intra-abdominal pressure, and if you work with a pelvic floor physiotherapist, particularly if you have, say, some scarring from a previous birth or anything like that within the vagina or even around the perineum, if you work on helping to get those tissues lengthened, so any scar tissue, if you get it lengthened a little bit, that gives a little bit more elasticity all over, and in some cases it can even resolve prolapse. So try to, as much as possible, work to improve the symptoms. Make sure that you're doing pelvic floor exercises to get a good lift in the pelvic floor, and learn to breathe properly. Some hypopressive exercises can be very helpful. There is a full series of hypopressives on the channel as well that you can take a look at. But try not to stress, and it's very hard to say don't stress when you're stressed about whether or not you're going to get pregnant. But the more that you can relax and the more that you can allow things to happen without worry and without too much tension in the body, then the easier it is for the body to do what it is designed to do. So I hope that helps. I hope that helps to answer your question. Ruth says, very helpful for me. I'm glad you think so. Gail says, thank you. You're very welcome. I'm glad you're a whole different woman, Ruth. That's really fantastic. You know, the whole point of the channel, the whole point of the platform that I created and the book, it's all about empowerment. So you can empower yourself. And I went through a huge part of my life not knowing that I could empower myself, and feeling that the only way I could fix my issues was through surgery, feeling that only somebody else was able to do things for me. But once I empowered myself to be able to deal with the conditions that I was living with, my life became so much better. And you know, I was told after the mesh removal that I would be forever incontinent, and when I regained my continence, I was just like, I have to tell other people, because from where I was to where I am now, if I was able to do that, then anybody can. So you empower yourself by taking control and by actually doing something consistently. You make really big progress. So let's see. Sonia, I have a follow-up question about intra-abdominal pressure. Okay. If you lift with prolapse, you don't want to put pressure on the pelvic floor. So the two things to do are either to have a soft diaphragm, so actually the diaphragm gives into pressure instead of the pelvic area. Alternatively, you keep your entire core stable so that no pressure can build. Am I understanding this correctly? So when it comes to lifting, it really depends on how much you're lifting. If you're lifting very heavy, so let's say, Sonia, if you're going to the gym and you're lifting really heavy weights for you, where you're not, where you have to actually control something without, or otherwise you'll injure yourself, then you need to create a solid canister. I mean, that's basically what it comes down to. So the pelvic floor has to be strongly engaged. The core has to be engaged, so you have to have activation, but you're pressing out a little with the core and with the ribs, and you have to do it with a full inhale. So you basically inhale while creating a solid canister. You make one big solid piece of the whole center of your body, but you need to have a really strong lift on the pelvic floor as you do this. And then you do your lifts, and you can do the exhalation. So for example, if you're doing a deadlift from the floor, then you'll take the inhalation at the floor. So you create your canister at the floor, you take a little bit of tension, nice solid core, and then you do the lift, holding the breath, and then you put the weight down, you exhale, and then again you create the canister and you come up, holding the breath, come down, exhale, and go again. Or if you're, let's say you're doing a barbell squat, so then you're going to take the inhalation when you're standing, so you're at the top, and then you're going to hold the solid canister. And it's really good to wear a weight belt if you're doing either of these things. It's actually much easier to press out into the weight belt because it gives you something to focus on. And then you do your squat holding, and then when you come back up you exhale, and then you take the inhale again. I hope that makes sense. Now if you're lifting lighter things, it's a lot less relevant. You do need to have some contraction in the pelvic floor, but when it comes to the breathing, you can breathe. You don't have to worry so much about whether or not your diaphragm is moving. You don't have to think of softness, but you do have to think of a strong pelvic floor. So that is actually the most important thing. The strong pelvic floor, when you contract, sits a little bit higher, and that's a little shelf onto which the organs are basically resting. Not completely, because of course you have all of your connective tissues, but you need that upward pressure to kind of counter the pressure when you're lifting. I hope that makes sense. Ask a subsequent question if that didn't make sense. It's so much easier actually to do this with someone, to put the hands on and get them to do the lifting. So Thomas Daly, how big should your poo be? As big as your body makes it. That's the answer today. Ruth, sending some love hearts, very good. Laura, sorry, I have another question. Is it normal after 2 months of daily relaxation stretching? I even more have the urge to pee directly after those stretches, and even more burning. Okay, so if the stretches are giving you a burny sensation and making you want to pee, that can be an indication that there is some, let's say, possible adhesions around the bladder. So it can be really good to go for visceral mobilization, if you've ever heard of that. So this is a technique where they actually will do a myofascial release of the visceral tissues around the bladder and around the abdominal cavity. They can also do this in the pelvic floor, because sometimes there can be a little bit of tension, so that when you're doing the stretches, you're also stretching a little bit the bladder if there is some tightness or some scarring in the bladder. Now, sometimes that tightness and scarring can come from UTIs. So if you've had urinary tract infections, then sometimes there can be a little bit of scarring in the bladder. Or if the adhesions, let's say if you've had a cesarean section, for example, you may have some adhesions, some fascial adhesions in the stomach, or any kind of other abdominal surgery. So have you had any of those, I would ask. I would look into visceral mobilization. Now, if you go onto theflowerempowered.com, you will find a lot of pelvic floor physiotherapists in the specialist directory there. But if you can't find somebody who's listed visceral mobilization there, or myofascial release, you can ping me a message on just from theflowerempowered.com, and I just let me know where you are, and I will see if I can find somebody local who's doing visceral mobilization for you, because that can be really helpful in getting that kind of burny, stingy sensation to calm down. And also, I will say to you that if that is what you're experiencing, then don't go end range in the relaxation. So you could, just like I gave some advice earlier on fissure, if you're dealing with the anal fissures, then or urethral either, where you have delicate tissues that are tearing very easily, then instead of opening to full range, use a lot of support. So practice more the restorative style of yoga than the yin style of yoga, although it is sometimes good that you get that little bit of stretch in the tissues. But I think visceral mobilization might be the best thing for you to try. So I hope that makes sense. Rose says, hi, my prolapses feel a lot worse from the end of my period to ovulation, opposite to other people. Any thoughts why this might be and what I can do? Wondering if hormones or something else altogether. It could be hormonal, and the cycle that we follow, we're not all exactly the same, but if you can actually typically feel at certain points in the cycle, you can feel the cervix, and it may be that yours sits a little lower at a different point in your cycle. So I'm not sure if you're already checking cervical position. It's not something you have to do. Some people do it. Usually people do it if they're trying for natural family planning. So they'll check the mucus, the type of mucus that they have, to let them know where their cycle is, and they'll also check for the cervical position, because that helps to let them know, and also then the basal body temperature, so the temperature first thing in the morning, because you can plot that out, and it can let you know if you're in the luteal phase or the follicular phase, if you're producing progesterone or estrogen, and usually you can identify where the luteinizing hormone is, so where you have the ovulation. But sometimes it can be a little different. Now, Rose, if you haven't already been to a pelvic floor physiotherapist, I would strongly recommend that you go to one. It may be, if your prolapse is feeling a little bit worse at a different stage in your cycle, it may be that you have some connective tissue scarring somewhere that is pulling a little in the later stage of your cycle, or after your period up to ovulation. So it could just be that there's a different line of tension pulling at that stage in your cycle. And there's also some cases where the uterus can be retroverted, so where the uterus, instead of laying on top of the bladder, can be sitting in the other direction, and that would also indicate that could indicate why there would be a difference. So I strongly recommend, if you haven't already done so, go to a pelvic floor physiotherapist, or also you can go to a gynecologist and just get checked to see how everything is. So I hope that makes sense. Neha wants me to share the Yoga Nidra link. I will do that. I will drop it into the description. Let's see. Oh, Ruth is a Rolfer. Fantastic. That's really good. You can do your own Rolfing. That's really good. I really love that. Laura says, can birth control be of influence on the pelvic floor muscles? I heard that hormones can be of influence, but I don't know if that's a myth. Hormones influence everything, really. so yeah, your hormones can play a little bit of a role, but usually the thing that has a bigger impact on your pelvic floor is what you think. So very often the pattern of holding tension in the tissues comes from where we place stress. So when you are stressed in your mind, if you can bring your attention into your body, what you'll probably find is that you're holding in a particular way. And some people hold around the chest, and some people hold around the hips, some people hold in both of those places. The closed heart, that's a protective response, and that is literally the thoughts, the fear, the worry, whatever, just coming into the body, the I'm not sure, whatever it is, that's it. So if you can get your body to stop adding tension when you're feeling a little bit of stress, that I think would probably have a bigger impact. Now, of course, your hormones dramatically impact the way that you feel. So your feelings are chemicals, really. Your hormones are chemicals, and your body's ability to contract and relax is also controlled by chemical reactions, electrical impulses from chemical reactions. So there is definitely a connection, but the rather than trying to completely understand how everything is connected, because it's very complex and even the brightest of sparks can't figure it out, try to come all the way back to, can I let go, can I relax, can I release, and can I calm down. If you're taking artificial hormones and they're creating issues in your body, and you feel like that they're creating issues in your body, then talk to your doctor about either changing your hormones or find an alternative to taking those hormones. Laura says, I hope that answers your question. Laura says, can birth control, you answered that one. Now the next response, never had an abdominal surgery. I will look up visceral mobilization. Ramona, what's her surname? Ramona Harmon, I think, is the lady who teaches it with Herman and Wallace. If you're going to a PT in the Netherlands, there's lots of people there. I know there's lots of therapists globally that are doing visceral mobilization. I know that there's not as many people trained in Europe as there are trained in the US. I think it started as an osteopathic technique. It's a little along the lines of Rolfing, which Ruth does, but it's more focused on the visceral tissues. It's more focused on kind of releasing tissues that are kind of in the intra-abdominal space. So it's definitely worth looking into. And if your PT hasn't heard of it, and if she's not trained in it, maybe she will train in it, and maybe then she'll also be able to help you. Let's see where we're at. It is we're 30 minutes in. Do we have any more questions? If we don't have any more questions, then and maybe I'll just tell you a little bit about what's coming up on the channel. So we have tomorrow a yoga video where it's just going through a short flow, 15 minutes, that you can do while working on the maximum strength contraction. So if you've been working on the 30-day challenge, if you've been working on trying to get maximum strength contractions, then you go through this sequence, and then in certain positions you're going to take the maximum strength contraction on the exhalation and then relax it on the inhalation. So that's a good it's a good practice. It's a really great way to make your pelvic floor strong. And the wonderful thing is that you're in lots of different positions, so you're reaching in for those maximum contractions in different positions, and you're really challenging the body while also challenging all of the tissues in the yoga poses in all of those different directions. And then we have on Tuesdays I'll be continuing with relaxation videos. So I have a series of new relaxation videos coming up, and also I'm going to be doing some more restorative yoga for those of you who are interested in trying some restorative. If anybody has any ideas or anything that you would like to see featured, please do just send a little message on theflowerimpowered.com, or just you can comment on one of the videos. And the book, still working on that. It's getting very close, so hopefully that will be out it's looking like mid-June. So fingers crossed that happens. So I'd like to thank you all for joining me today, and I'll do another live next Wednesday. You can send questions in ahead of time if you like. I'd be more than happy to start the live with some questions. Let's see, Rose says, thank you, it's interesting, could be a number of different things. Recently told you have a retroverted uterus, but no idea it could be relevant to prolapse. Yeah, it can. And there's actually, I know that there are some osteopathic manipulations for putting the uterus back the other direction. There's also surgical procedures to bring the uterus back, but many women do live perfectly happy, normal lives with a retroverted uterus. So it's not necessarily a big issue, but it is something that you can do. Susan's looking forward to the relaxation videos and the restorative yoga. I'm glad to hear that. It's, I've tried, I don't know if any of you have seen, I tried a different style for the video yesterday, because I'm always talking in the pose and then I'm not actually really demonstrating it, because in order to really practice yin, you have to let go completely. And when you let go, your connective tissues slowly release, because they release they're a little bit more like plastic than elastic. They do have elastic properties, but they stretch slowly. So the video last night was more kind of relaxation, so I actually got to practice, which was really lovely. And I'm going to do the same for the upcoming ones. I'm going to actually just relax into the poses, so you get to see how the body adapts over the duration of the 3 or 5 minutes of the pose, and hopefully that'll be useful. But do please let me know if you do one of those videos. Let me know if it helps to have the timer on the screen, and if it helps to actually see the practice, or I will be still waffling. But let me know if you'd rather if I waffled while doing it. And Maverick says, hey Denise, I suffer from pelvic floor spasm during sex. Would relaxation videos help that? So relaxation videos will, they can help. Dilation may also help. So if your spasms are from vaginismus, if the contraction is happening and stopping penetration, then it can be very good to do relaxation and then to do vaginal dilation. So with some dilators, which I have here. So I have lots of different types. So these are little small dilators. They come in lots of different sizes, and you can actually practice penetration with these, and that can help. Now, if it's more dyspareunia, so where either you're getting a spasm that's not preventing penetration, but that's maybe a spasm after orgasm, for example, that can orgasm can lead to stronger, more painful contractions. Then it can be good at that point to do the relaxation, so right after sex, to help to release those spasms. Or if maybe you've seen, there is a PNF technique for obturator internus release and piriformis release, 2 different releases on the channel, and they can actually help if the spasm is after sex. And you're a guy, so then you're definitely not going to do dilation. Okay, so then my question to you, Maverick, is the spasm during penetration, or is it with orgasm that you're getting the spasms? So that would be my question to you. And when you answer that, I'll give you a second answer. And then Laurie is asking, I have stress incontinence. Can these exercises help? Should I consider surgery? This was from one day to another, along with bladder prolapse, all from a chronic cough I had for 3 weeks. Yeah, chronic coughs can trigger what seems like a very sudden onset of urinary incontinence, and it literally is just because each of your coughs is like a punch to the pelvic floor. So whenever you cough, your pelvic floor gets a very strong downward force that stretches by the pelvic floor by about 2 centimeters, and if you have already a little bit of weakness, then this can tire out the pelvic floor, and it can make it seem like you have an all of a sudden issue. Now, the same thing goes with the prolapse. Prolapse can be worsened by coughing, but the good thing is that if you do pelvic floor exercises, you can actually rebuild strength and you can reverse that type of incontinence. So I would say don't even think about surgery until you've at least tried a 1.5 years of treatment to get the pelvic floor muscles stronger, to get the breathing going well, so that you also work a little on trying to get the connective tissues to strengthen. So there's a lot of connective tissues that are reaching down to hold onto the pelvic floor, and there's a lot of connective tissues that are going around the organs. So the ligaments of the uterus, there's like a whole network that come from all the different directions, and if you do hypopressive exercises, this kind of lifts things up a little, and your connective tissue has these small cells that move and create what looks like a little slug trail, and those little slug trails turn into fibers. It takes a long time for those fibers to build and for connective tissue to rejuvenate. Muscles will rehabilitate much faster than connective tissues, but you can actually make a huge improvement if you do consistent pelvic floor exercises. Sign up for the 30-day challenge. Go to the video, the preparation video. You can assess your pelvic floor. You can work at that level before you start doing the exercises, but you can definitely make a big difference. Okay, Maverick, you didn't come back yet to say if the pain is during penetration or if it is with ejaculation. But I just want you to think of it this way: getting the pelvic floor to relax can reduce spasms, but also working a little bit on getting the abdominals to relax, because if you have tension, particularly in the obliques, they actually reach down into the male pelvic floor, into the cremaster muscle, which goes like down around your balls. So if you're feeling that that you have pain in that area, then getting those tissues to lengthen and to relax a little bit can help. So pelvic floor relaxation is what I would suggest you try. Susan says, are the PNF and obturator relaxation videos on your website? The PNF and the obturator videos are on YouTube. So some of you, you're speaking from Facebook. Okay, so this is live both on YouTube and Facebook, but the videos are on YouTube. So if you go to the Flower Empowered on YouTube, you'll find the videos there, and I'll put a link to them after this onto the Facebook page as well, so that they're there. Let's see, and you're also asking levator and ani relaxation. So the PNF stretches for the obturator internus and the piriformis, they both help a little bit to release tension in the pelvic floor, so they can help with the levator ani as well. And there's a lot of other relaxation videos on the YouTube channel that can help with just getting the pelvic floor in general to relax. It's kind of hard sometimes to reach the pelvic floor because it doesn't move an awful lot. There's very little movement in the hips. I mean, there's a tiny little bit of nutation. This moves a lot more than the hips actually move. There's a tiny little bit of movement in the sacrum, and then there's a little bit of movement when you walk, and it's literally the SI joints that are moving just a tiny little bit, but it's millimeters. It's not a huge amount. So the best way to get to the pelvic floor is to pull on the obturator internus and the piriformis, because those are, like, let's call them the walls to the pelvic floor, and they strap on to the greater trochanter either side of the leg. So they strap on to the outside of the legs. So they strap the pelvic floor to the legs. So by moving those muscles, by making different movements with the legs, you can actually reach into the pelvic floor. So that is what I have to say about that. Ruth is saying Yoga Nidra level 5, Amta Swarupa, experience the true eternal nature. I assume that's a wee link you shared. Fantastic. I love Yoga Nidra. It's like one of my favorite things to do, and it's all about letting go. And if you can actually stay awake to the end of the Yoga Nidra, then you're not doing it right. And I'm joking. I always fall asleep. It's just one of the things. Laura says 30-day challenge for a tight pelvic floor, just a suggestion. Yeah, that's actually the other thing. The 30-day challenge, we do have the contraction exercises, but each video also has a relaxation, and each video is a little different, where we have a slightly different focus, and all of those different exercises are really good for letting go of tension. So, okay, where are we? We're at 6:42 p.m. in GMT. So that is 7:42 p.m. in Sweden, and I'm not sure in Boulder what time that is. I'm not sure where everybody else is, but I will finish up now. I will do this again next week, so if you have more questions, or if you have a follow-up question from today, please, you can either send me a message or just jump onto the live next week and you can ask your question there. So thank you all, and I wish you all a really lovely evening.